This is a presentation over the neurological screening for pain.
The objectives for this presentation is to determine the population with which this pain screening would be used and to describe and demonstrate procedure for pain screening.
The population that you would use this screening with would be any patient that has sensory loss or deficits in the primary somatosensory system, such as any neurological condition, including but not limited to CVA, multiple sclerosis, TBI, as well as those with burns or edema. The primary somatosensory system includes light touch, pain, temperature, pressure, vibration, proprioception, and kinesthesia. It allows a person to distinguish when tap water has become too hot or when a hair is on his or her arm. It is mediated by skin receptors, spinal nerves, spinal cord tracts, and the cortical somatosensory area 1.
The procedure for this screening is to start with the patient seated on a mat or in a chair in front of a table. Occlude the patient's vision. You may use a paper clip, safety pin, or a flat-headed screw. Randomly apply a sharp or dull stimulus to the screening area. Apply the stimulus to the patient's face, upper arm, forearm, digits, bottom of the feet, and toes, in accordance with the dermatome chart. Apply the stimulus 3 times to each area and ask the patient to indicate if it is a sharp or dull stimulus that is being felt.
This is an example of the dermatome chart that you could use as you're working on your screening. Here's a demonstration of the screening itself.
Okay, so the following is a demonstration of the pain screening that can be used with adult neurological populations, specifically those that have primary somatosensory deficits. For the sake of time, I'm just going to demonstrate on the forearm and the hand, but you can also apply this to the patient's face, upper arm, the bottoms of their feet, or their toes, and then in accordance with the dermatome chart. So to perform the test, you're going to need something with a sharp and a dull end. So you can use a paper clip that's unfolded, you can use a safety pin, or you can use a flat-headed screw that would have the flat would be the dull and then the sharp. So the first step, you're just going to occlude the patient's vision so that they can't see what you're doing, and then you would ask them to indicate whether they're being touched with the sharp or the dull end. You're going to apply the stimulus 3 times to each area just along that dermatome, and then determine if they have any sensory loss in that area. So I'm going to use the screw. So you would move from distal to proximal, so you would start out on the ends of the fingers and then you would move up along the dermatome. So close your eyes, okay, and then open your eyes. I'm going to let you feel, this is what the sharp side feels like, and this is what the dull side feels like, okay? So what I'm going to do, I'm just going to move up and touch the sharp or the dull side to your hand and your arm, and I just want you to tell me if you feel a sharp or a dull. Okay? So close your eyes. Okay? Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. 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 Dull. Sharp. Dull. Sharp. Sharp. Okay, good job.
These are the following references that we used.